In this PowerPoint, we are going to look at the organisms involved in the development of a urinary tract infection. Specifically, it will look at the two organisms E. coli and Klebsiella pneumoniae and how they work together to develop a urinary tract infection. A urinary tract infection is commonly referred to as a UTI, and it is an infection of the urinary system. It can include upper and lower urinary tracts at the same time, or it can be isolated to one part as either an upper urinary tract infection, known as pyelonephritis, or a lower urinary tract infection, known as cystitis. A UTI is one of the most common infections in the United States, and it is more prevalent in women than in men. Likely, over half the population of women will develop a UTI at some point in their life. And while contracting a urinary tract infection is already common, it is even more common for people to get infected if they have already experienced a previous UTI. Further, the use of catheters can change the way a UTI is developed. It can cause a complication and show different forms of the bacteria found in uncomplicated UTIs, as we will see on the next slide. This figure shows the most common causative agents and risk factors associated with uncomplicated UTIs as well as complicated UTIs. The main difference between these two graphs is that an uncomplicated urinary tract infection usually affects individuals who are otherwise healthy and have no other disease or infection, while complicated UTIs are normally associated with factors that compromise the urinary tract or the host's defense. As seen here, the risk of contracting an uncomplicated UTI is highest among women, children, and elderly patients who are otherwise healthy, while the risk of developing a complicated UTI increases with things such as urinary obstruction or abnormalities, immunosuppression, renal failure, pregnancy, and the presence of foreign bodies, exposure to antibiotics, or, as we mentioned before, the use of catheters or other drainage devices. The most common causative agent for both uncomplicated and complicated UTIs is E. coli. There are two other agents which appear to be more prevalent in complicated UTIs than in uncomplicated UTIs, and these are Klebsiella pneumoniae and Staphylococcus saprophyticus. When isolating bacteria in patients with a UTI, E. coli was by far the most common culture that was found. It had a frequency of 67.21%, and the sample size was 82. The next highest organism found when isolating the bacterial components had a frequency of less than 10%. The organism was part of the Proteus species and had a frequency of 9.83%, and the sample size was only 12. E. coli was originally discovered by Theodore Esrich back in 1885 and is found all over the world. It is a rod-shaped gram-negative organism and foodborne pathogen. E. coli is known to cause many diseases in humans. However, it does not always have to cause harm to humans. E. coli can colonize in the gastrointestinal tract and be unharmful to the human host. It becomes harmful when virulence factors such as transposons, plasmids, pathogenicity islands, and bacteriophages come into play. Klebsiella pneumoniae was first described as a bacterium by Carl Friedlander back in 1882. It was first named after him, and they called it Friedlander's bacillus. This organism is a gram-negative encapsulated, and it is non-motile. It is commonly found in the environment, and it was first described as a bacterium that was isolated from the lungs of deceased patients whose cause of death was pneumonia. The symptoms of a urinary tract infection are pain or burning during urination, frequent urination, bloody urine, and/or pressure and cramping in the lower abdomen. Once a patient experiences these symptoms, it is recommended that they receive treatment from a medical professional as soon as possible. The doctor can also ask the patient about their symptoms to try and narrow down possible causes of the infection and what it may be. Doctors can also test for signs of the infection by running urine samples and testing for bacteria or by doing a physical examination. Since urinary tract infections are caused by bacteria E. coli and Klebsiella pneumoniae, it can be treated by prescribing the patient antibiotics to fight off the infection. It is crucial that the patient takes the antibiotics exactly as they were prescribed and they take the full dose regardless if their symptoms are gone prior to the completion of their medicine. The cost for treatment and testing for a urinary tract infection is not very expensive, and there are a number of things that patients can do to help reduce the risk of developing a UTI. For example, it is recommended to urinate after sexual activity, stay hydrated, take showers as opposed to baths, and minimize the amount of products being applied to the genital area, which include douching, sprays or powders, and women should be taught at a young age to wipe from front to back instead of back to front.